Hey there, it's Dr. Sarah here. Today on the She Found Motherhood podcast, I'm chatting with Melanie from Better Birth Stories, Hypnobirthing and Positive Birth. We're talking all about, you guessed it, hypnobirthing. Melanie is the founder of Better Birth Stories and a senior clinical hypnotherapist and accredited certified EFT practitioner. She's also a mom of 3 young kids. Melanie and I talk all about hypnobirthing. What is it? Who can benefit from it? And how can you access it? Now, before we get into the podcast, I wanted to remind everybody of how important both Dr. Alicia and I think it is to be prepared for birth and postpartum. And one of the ways that you can prepare, in addition to taking a comprehensive birth preparatory course, is to do a birth plan or birth preferences document. And we've put together a free template you can use and a 4-video webinar series that will help you fill out your birth plan. If you're interested, head on over to shefoundhealth.ca/birth plan course. We'll put the link in our show notes as well. We'll get into the podcast right after this. Welcome to the She Found Motherhood podcast. We are Doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
All right, Melanie, welcome to the She Found Motherhood podcast.
Yeah, it's lovely to be here. Thank you for inviting me.
Oh, I'm so thrilled to have you. So Melanie and I met on Instagram, and your Instagram handle is, remind me?
At Better Birth Stories.
At Better Birth Stories. And Melanie jumped out at me because her expertise is hypnobirthing.
It is wonderful, lovely hypnobirthing.
I know.
And I witter on about birth on Instagram, but I'm sure you must, despair occasionally.
I know. So I'm so excited to chat with you today about hypnobirthing. And I thought maybe we could just start by you telling us a little bit about yourself and how you got into this area of work.
Absolutely. It's interesting because many people come to teaching hypnobirthing because they have had a marvelous birth. Mm-hmm. So their teaching is then completely framed by the wonderful experience they had. Interestingly, I came to hypnobirthing because as a hypnotherapist and an EFT tapping practitioner, and a Human Gibbons rewind practitioner, I, in clinic, deal with birth trauma. So I work with a lot of women who have gone on to have postpartum anxiety, postpartum depression, or post-traumatic stress disorder. And that was what I did before I did hypnobirthing. So I did a little bit of hypnosis for childbirth, but predominantly I was helping women through the memories and the experience of their birth. Mm-hmm. And after a period of time, it did get me to thinking that there has to be a better way of doing this, that I was hearing the same story again and again and again. And it really was, I didn't understand what was happening. Mm-hmm. I was scared. Mm-hmm. Nobody was talking to me. Mm-hmm. And you soon realize that almost identical births can take place. Whereas one woman or one couple can walk away from it and feel like, okay, look, it wasn't the birth of our dreams, but it was fine.
Yeah.
And another woman can be absolutely shattered by the experience.
Totally.
And it really takes you into kind of mental resilience, but it's really understanding birth, understanding where you are and all the processes that can come from it, and then creating an amazing birth team. So that really drew me in. So from there, I started teaching hypnobirthing, and it's really informed the courses that I run and the online course that I've created, and my writing on Instagram as well.
Yeah.
No stuff.
Yeah. That's so interesting. And, we were chatting just before we started to record, and that's, what I was sharing, the same reason Alicia and I started this community was because we find it so devastating when, families and couples that we're supporting through birth are disappointed in their experience and, traumatized. And so we want to help educate and inform. And I don't know a lot about hypnobirthing. I didn't use it myself. I was an epidural girl. But, maybe hypnobirthing would help.
Nothing wrong with an epidural when used effectively.
Yes. So tell us, what is hypnobirthing?
Well, for me, and obviously there's lots of schools of thought with hypnobirthing. A better birth stories, I teach hypnobirthing as a study of 3 distinct spaces. And the first one is what's going on up in your head. What do you know about birth? What do you believe to be true about birth? What are your belief systems? Is your experience of birth watching Grey's Anatomy? Because that's not good.
Agree.
Did your mum have a great birth with you? What about your family? If you're constantly told horror stories, you're going to have a really effective blueprint about birth being really frightening and dangerous. Or on the other hand, have you been surrounded by really amazing positive birth experiences? Because then your blueprint's going to look very, very different. And we pull upon these blueprints as we move through pregnancy, labour and birth. So the first space is what's going on up in your head. What do you know? What you don't know? And all of these wonderful hormones that are being presented by all these thought processes that are delivered down to your body. So the second space I then teach about is the physiology of birth. Okay, what is actually happening? Because it's really surprising how women arrive at the point of giving birth with so little an idea of physiologically what's actually taking place. And I think as soon as you explain it, it's actually really very simple. I mean, it's a wonderful cocktail of hormones and muscle movement, but it's actually quite simple. So just looking at the uterus, having an understanding of language as well. So how surges or waves or rushes or contractions, however you want to refer to them, actually affect and how this goes forward to birth your baby. And then the third space we look at is the landscape, the birth landscape. And it's really interesting with the Facebook group I run that the birth landscape is obviously going to be very different for those mums giving birth in the UK or in Canada or in the US or anywhere around the world. They'll have very different hoops and protocols that they have to work within. But you see, that landscape and other people's opinions on birth will be affecting what goes on in your mind in that first space. What's taking place in your body? Is your baby breech or transverse, or do you have gestational diabetes, or are there any other issues? These things in your body will be affecting the landscape and what's going on in your mind. So you can't unpick these 3 things. And I think what's been happening in the past is people have been going to their antenatal classes and being told physically what's going to happen. End of. Or you go into the hospital for the birth course at the hospital and they'll tell you all about their landscape, all about the pain relief and how it's going to work and what they will be doing to you. Or if you're lucky, you've gone for a mindful breathing or a mindfulness course and you've just learnt all about what's going on in your brain. But they can't be unpicked. One runs into the other and they all knock on affect each other. So hypnobirthing is a real umbrella term for those 3 spaces. And it's just working through them, getting them aligned, getting great knowledge, great birth teams, and the skills and drills for you to be able to relax and actually move positively towards your birth, irrespective of what type of birth that's going to be. It doesn't, I think there's a bit of a misunderstanding that hypnobirthing only supports drug-free, epidural-free home births under a full moon. And that's not the case at all. You can use your hypnobirthing skills for any type of birth. And in fact, I think they really come into their own if things do get a little bit tricky, because that's when the adrenaline's going to come in. That's when the fear is going to come up. And if you've got effective tools to be able to calm everything down, if you've got a fantastic birth partner with you, you're going to be able to make really great nuanced decisions for your care. There's something I say to my anxiety clients, and it really is, the more anxious, the more upset you're going to get, the more stupid you're going to become. And it's cruel, but it's true.
But it's true.
Because we're going to take this lovely cortex, this lovely thinking brain that we have just offline and go into black and white thinking. And I think that's where the problems start to occur. So what else do they get? They get MP3s. So they actually get hypnosis. So in my role, obviously, as a hypnotherapist.
Yeah.
That ticks one lovely box. So we get to do these wonderful things they listen to as they go to sleep each night. That's just changing those blueprints. So taking away the Grey's Anatomy and the ER view of birth is this kind of terrible thing that's going to happen and George Clooney will rescue you, and planting in the very fundamental reality that birth is normal. Yeah. It's normal. And you are the product of that normalness. Yeah. Thousands and thousands of years. Yeah. So hypnobirthing. It's funny, isn't it? That it's just this one term, but it has to cover so much.
It's not like, you hear hypnobirthing and you think it's a very sort of unique, program or opportunity for a select population, but it applies to everyone. And, I really like how you said it doesn't matter, because I think of people who are having planned cesarean births, that is a really intense experience. You go into the operating room or the operating theater without your partner, you're getting a spinal, you're by yourself, there's a busy team all around you, it's a sterile field, a sterile environment. Having those skills is hugely important.
Yeah. And also, if you think about when we birth in a hospital setting, and for many people that is going to be the most appropriate setting to birth in, there's no denying that. Yeah. But when we move into a hospital, it's going to trigger these little blueprints that we have in our mind. Yeah. And you don't go to hospital for fun. You go there because someone's sick, or you go there because you were sick. So suddenly we expect women to walk into hospital feeling confident and calm and brave. And that might not be their blueprint. Mm-hmm. I was working with a woman not so long ago, and she'd started passing out in Asda in the supermarket. And having panic attacks, and we couldn't figure out for a little while why supermarkets were suddenly blowing everything out of proportion. And we wound it all the way back to discover it was the floor, because the floor in the supermarket is exactly the same as the floor in the hospital. Wow. And what happens when we get very worried or when traumatic things occur is we take little snapshots, and our mind will be obviously trying to get snapshots of all the things that are very bad, but it'll be including all this other information as well, such as shiny floors. Mm-hmm. So these little blueprints that we store in our minds can be really diverse. Mm-hmm. Even though we think we're just looking at birth, we're looking at the whole picture. And as you say, with a C-section, it is scary. Yeah. And I think we have to be able to say, do you know what? It is a bit frightening. We are having major abdominal surgery. Yeah. And something such as hypnobirthing that teaches you self-hypnosis, breathing skills, guided visualization, so that you can relax and be somewhere else. Mm-hmm. Yes, that looks at things honestly. One of the most viewed videos I have on YouTube is one about pain. Yeah. And it's this whole argument, there seems to be these two camps that say it's going to be painful, get your epidural. Mm-hmm. For a C-section, highly recommended. But it's not pain, it's pressure. Yeah. And I'm just like, well, you don't know till you get there, do you? Mm. So it's about exploring things such as hospitals, such as C-section, or any of the other bumps in the road, and just being very honest with women and saying, I have no idea what you're going to feel in labour. Yeah, I don't, because I don't live in your body. Mm-hmm. But then giving the skills and the confidence to be able to understand that it's something that changes you, birth. It will change you. Yeah. If you haven't had children before and you're going to have a baby, your life is going to turn. It's going to pivot 180 degrees. And you are going to be a totally different person. Mm-hmm. And it makes sense then that this birth is a mighty and a big and a slightly daunting and scary and a powerful part of your life, because it's going to change you. You're going to be a mother and you weren't one before. It should be a big event. Yeah. And I think when we reframe it in that sense and we look at it and we welcome the pain of labour, and I'm not saying all women do. I mean, gosh, orgasmic birth has more followers on Instagram than I do. So there's obviously something going on there that's really positive. Yeah. But for the rest of us, if we do feel this huge energy rolling through our body, we can greet it like a friend. Yeah. Because that's where it works. We don't have to pedal back and tense ourselves in. We can actually relax and open up to it, because it's effective and it's something we are. It's a path we're taking. Mm-hmm. It's the equivalent of walking through fire and coming out the other side. Yeah. And knowing that we're going to be whole. Yeah.
Yeah. Oh, it's beautiful. Well, and I try really hard and making sure people understand what's happening during birth, even if it's an emergency, explaining, okay, your baby's heart rate has dropped. We cannot get it back up. We need to, intervene immediately.
Yes, because what happens a lot is you hear these stories and women aren't told. They're just, the room's flooded, the alarm's gone. And these are the stories that are loudest. Quite rightly, because if someone suffered a bad birth, they need to talk. They need to.
Oh yeah.
But it's constantly reminding women that, look, this is a small percentage. Birth is normal. If you watch it online, you'll probably see it's very dull. The people that work in it.
Yeah.
It really is. It happens all the time. And for the most part, it's very normal. It ticks along fine, and there's a wonderful surprise of a baby at the end. But it's funny, isn't it, how these really powerful, painful stories take the biggest, richest vein, don't they?
Yes, absolutely.
Because of how we digest trauma, really. But the more information women can have, and their birth partners,
absolutely,
the more they can take in with them. And I know I do get told off in the room because I do come across as incredibly anti-induction, but it's not anti, it's have you read the evidence?
It's about empowering them with information.
So that they don't end up in a situation where one thing is cascaded into another. And they didn't even know that might happen. So now it's wonderful that women are going, well, hang on, am I at risk? Is my baby at risk? What evidence are you looking at? This is the evidence I'm looking. And then they're making really informed decisions. Because induction isn't a bad thing. It's just a blunt instrument. And for some women and babies, it's going to be the perfect choice. But for other women, it might not be. You're not going to be able to make the decision unless you understand the material behind it.
And understand your body, right?
So this is where you hit my Instagram account and I'll be frothing at the mouth about something again. But it really is about, just putting it out there constantly and inviting people to talk about birth and learn about birth and normalize birth.
Absolutely.
And your group B strep.
Yes.
I was listening to earlier. And again, that is so vital because it gives people information. It's a really difficult conversation, group B strep. I mean, there's a lot toing and froing about it. And it sounds scary. But when you listen to a podcast and when you hear and it's laid out on a table for you, it becomes so much easier to make decisions.
And you understand why certain things are recommended or not, in the evidence behind them, instead of, okay, here's the swab, here's what's happening.
And panic and go to a Facebook group and ask them instead.
Exactly. So I have a question for you. If people are interested in hypnobirthing, what is a good time in their pregnancy to start to learn about it?
I would say second trimester. Because you're past all the bumps of the first trimester, secure in your pregnancy, and then you've got plenty of time to learn and practice. That doesn't mean to say I don't teach people at 38 or 39 weeks. It happens all the time, and we just work with what we have. So even if you have discovered, you've listened to this, or you've discovered hypnobirthing and you think, oh hell, I'm 37, 38 weeks pregnant, I'm too late. You're really not. Because it's such a simple framework. And the vast majority of online courses or in-person courses, you could get through in a week. You could. And even if you just take some nuggets of how to remain calm, that would be perfect. The second trimester would be best.
And that's typically what we say, sort of like, 26 to 28 weeks, start learning, and it gives you the time, but you don't want to start
so early that you've forgotten everything.
Yes, exactly. And then if someone is having has done the training and they're going to the hospital, what does that look like hypnobirthing, in the room during birth? Is it, candles, no talking? Or tell us a little bit about what some people's birth experiences look like, because I'm sure lots of people have certain ideas in their mind of what they think a hypnobirthing experience would look like.
It's really individual. Really individual. I mean, there are some core sort of steel beams to it. And one of them is, don't try and give birth in bright lights. Because it's not going to work. You're not going to be getting the right hormones going through your body. You're going to feel exposed, open, watched. I mean, the worst things. I tend to say that wherever you would be most comfortable having a poo, you will be fairly comfortable giving birth. And that immediately makes you think about the room differently. You know, I'm not going to want lots of people walking in and out. Well, if you were having a poo, no. Okay. You need privacy. So a hypnobirthing practice, you're going to see people asking for, you know, people to be just out the room, no chit chat. Yes, you're not trying. It's not about saying no talking. It's about unnecessary chit chat.
Yeah.
Not necessary. A lot of women prefer to dim the lights, and in most hospital rooms that's fine, because they'll have a lamp over the sink, or they'll have an attached bathroom. You can leave the bathroom light on and then just turn the lights off in the main room. All midwives, obstetric nurses and obstetricians will help women with that. We tend to advise avoiding the bed because it's a TV thing, the bed, isn't it? I mean, the reason that all women walk in and sit on the bed and lie on the back is because they've seen it. It's a blueprint. So we tend to say, look, just push that bed to one side. You've got big bouncy balls, you've got mats, you can stand, you can walk, you can sway. So you will see a lot more movement, a lot more all fours in hypnobirthing. You'll see people using the toilet a lot more. So sitting on the loo, because it's such a fantastic position to birth in. Even though I do get lots of jokes about, do the babies disappear down the toilet? And I promise them, no, it's never happened. And even if they did clonk, they'll never know. No, I kid. But you will. I mean, some women love it, especially if they're at home. If it's a home birth, it's simpler to create. They can have fairy lights, their affirmations. But time and again, I do hear women who have created all this amazing pack, taken it to the hospital. They've listened to everything I've said. So they've held off at home. They arrive at the hospital and baby arrives an hour or two afterwards. And I didn't get a chance to get my candle light out and my fairy lights and my affirmations and my room spray. Another lovely hypnobirthing trick is if you're not birthing at home, you are transferring into hospital, to take an eye mask. Because again, that bright light, you know, you're in this cocoon of home and you need to get to the next cocoon, but you're going to be doing it in busy traffic in the back of a cab. Put your eye mask on. Headphones, so you can listen to your own music or your MP3s. And then I say, and also room spray or your own perfume, you know, just put something really normal and comforting to you and smell it. You know, it doesn't matter if you look daft with an eye mask on and headphones in when you arrive at the check-in desk. Nobody's going to blink an eye.
No, not at all.
We'll feel cocooned and safe and comfortable.
That's a nice tip, actually. Because I did that with all of my births, like labored initially at home and then to the hospital, and man, that drive sucks.
It's the worst, isn't it? You can make it the best, can't you? You really can. And you know as well that labor will slow in the car. It's going to slow because you're a clever, smart, intelligent mammal who doesn't particularly want to give birth in the passenger seat. It happens. But on the whole, we'd rather it didn't. So it really is about utilizing all of these tricks and tips. I don't know if you read it. There's a lovely book by Natalie Meddings called How to Have a Baby.
No, I haven't read that one.
Big books I recommend to everyone. And it's got a mother-centered guidance on giving birth. And she has loads of things in that. And these aren't hypnobirthing, but they are ways of promoting the body and the mind to work really nicely. So you're not walking in and feeling dazzled by lights and trying to answer questions and trying to pretend that everything's normal and, you know, all of the crazy stuff that just will put the brakes on labor.
That happens. And
I think about Canada, that sometimes if you're not moving along, you'll be sent home again in the UK, and that can be quite upsetting because you get
that can happen if you come in hospital and things aren't really progressing, then because if we keep you there, nothing's happening, we're going to intervene, right?
Yeah, absolutely.
And we don't want to if we don't have to. Go home and labor at home and come back.
Stay home. Powerful is good, but more powerful is better.
Hey Sarah, do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules, though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood Prenatal Masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and re-watch it when and where they choose.
Plus, it's got so much great information about preparing for the 4th trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the 4th trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the 4th trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
And so now for people to learn hypnobirthing, tell us a little bit about, your course and how they could reach you and how that would look like if they were to take a program through you.
COVID has been an interesting time, hasn't it?
Yeah.
Fortunately for us, I mean, I teach in person in London in the UK.
Yeah.
But about 6 months before COVID hit, I had released an online version of the course.
Yeah.
And it really is, it is just as if I'm teaching a person in a private class. So I'm just talking directly at them over a table in my office. And we were so lucky that we got that out because it's the entire course. So when everything went into lockdown and nobody could access or reach out for support or antenatal courses, we had it was packaged and they could buy it. So in that sense, we teach both ways. We have the online course that anyone can access. It's hugely affordable. And that's the main thing, because cost shouldn't put the brakes on a quality antenatal education. It really shouldn't. So, it's 39 UK pounds. I can't think what that is. I know US dollars is 47, but I'm gone on that.
No, it would be probably about like $80 Canadian, $90. I don't know the exchange rate, roughly, almost.
So they can just access it, watch it in their own time, listen to their recordings, get their editable birth planner, although I know you guys have one as well.
Yep.
And it's all there for them. Alternatively, if you're learning with me, you do so in London, in Southwest London, and you get me all day.
Yeah.
But if you are anywhere in the globe and you want to see someone in person, you just have to check for restrictions at the moment, because some of us are coming out, some of us are going back into lockdown. But places like the Hypnobirthing Institute will always have a list of teachers, and a lot of teachers have moved to Zoom as well, so they can teach you via a screen. Although find your community. I think even if you do have a teacher that's one-on-one, join a community. So we do have the Facebook group, which is marvelous.
Yeah. What's the name of your group?
Oh, it's really long. It's the Hypnobirthing and Positive Birth Group on Facebook. Hypnobirthing and Positive Birth Group. And it's lovely. It's one of the kindest, most generous group of 6,500 women I've ever been in. And it's there to share stories. So women get as much info as they need. They're part of the community. Then they give birth. Then they write their birth story. Yeah. And you have a whole mix of planned C-sections, inductions, home births, free births. We're totally non-judgmental about how anyone wants to prepare and do their birth. And it's wonderful as a resource. I mean, it's absolutely brilliant. It's a community. And I think that's the one thing we've needed more than anything, isn't it?
Yeah. And I think I really like it's empowerment, it's education, it's information, and it's non-judgmental, because I have patients that say they ended up with an emergency cesarean, and they don't want to tell people, right? Because they're almost embarrassed. And well, first off, I tell them, then don't. Like, who cares? Just tell them your birth was great. Full stop. You don't need to share. It's your private experience. But I wish that there wasn't that fear of judgment, and it's self-judgment, it's fear of judgment from others. But the more sort of positive, judgment-free spaces that we have for birthing people and postpartum people to share, because like you said, I'm not a trauma therapist, but I know that the more you share your story, the more healing it will be.
I mean, there's so many paths. We set off on labor, we don't know
We have
the
no
path
idea.
our labour is going to take. I mean, look, for the most part, it will unfold the same way
Mm-hmm.
again and again and again and again, for sure. But sometimes it won't.
Mm-hmm.
And when you're able and open to make great decisions about that without fear, then you can. I mean, I've got 3 kids. My younger 2 are twins, and I had a cesarean for them. So it's really interesting in the group when everyone goes, "Oh, I don't want a C-section. It's terrible. Oh, terrible, terrifying." And I come in and go, "No, it's not.
Yeah.
It's not. In the heat of the moment, that might be the perfect choice for you."
Totally.
And again, with epidural, no, if you can stay mobile, we know a mobile movement-based birth keeps that pelvis open, moving. So we know it's very good for birth. But if at any point you can't think straight, it's getting too much, you're losing a sense of yourself, then get some help. There are low dose epidurals. You can use the epidural as a tool, so you can use it for a catch time, get a break, get a rest.
Yes.
And then you can let it wear off to birth your baby.
Totally.
Or not.
Totally.
Yeah. And I think when people get really tied in knots about this, again, we are creating a trauma yet to happen.
Exactly.
So the more open we are about journeys and honest with each other about journeys, the far better our birth experience can be. I just think it's so long. We spent the last 100 years trying to go, shh, don't talk about that kind of stuff.
Right?
And really, in the last 10, 15 years, women are going, whoa, come on. We're going to talk about puberty. We're going to talk about birth. We're going to talk about menopause. And nobody's going to silence us, and we're going to talk about trauma. And the fact that we've got 30% rates of postpartum depression and, just be really honest about the whole mothering journey. And it's not about complaining about our lot. It's about, if we're honest, we can get support. And if we're honest, we support other people. And then we're birthing better as a community, aren't we?
Oh, absolutely.
So, and no judgment. I don't, never, if you come across a hypnobirthing teacher that offers you judgment, please drop them. Because it shouldn't. It's about tools, techniques, learning and understanding.
And
that's it.
We were talking before we started recording about how the big thing we don't want as, a maternity care provider is to someone come in and have their education have been targeted towards, how to avoid certain things. Because it's not about avoiding, it's about knowing what is right for you. Whether a cesarean birth is right for you, whether an epidural is right for you, whether forceps are right for you, right? Because everyone has these fears instilled in them that no, you want to avoid an epidural, you want to avoid this, you want to avoid that. And I just think it sets you up for disappointment.
It does.
Because not everyone can afford that.
The system at play at times in the UK, in the US, hasn't. We do have this protocol box ticking exercise that occurs. So it's that fine line we walk, isn't it? Of being able to say, look, you may be 41 weeks pregnant. Put the pineapple down. Put the castor oil down. Babies, the average length of pregnancy is 41 plus 2. Can you stop panicking? What do you mean you've had your 3rd sweep? What are you hoping to find up there? Wind it back, calm down. And I think we have over-medicalized birth. We know we have. And our way of doing that has kind of caused problems for those that need more medical birth. Because it set everyone reeling. And I think the stories you hear of women who walked into hospital at 42 weeks, because in the UK we tend to wait until 42 weeks before offering induction unless there is a problem. And they've walked in totally healthy, totally whole with a happy baby, and they've staggered out days later post-cesarean because they didn't really understand their options. They didn't understand the process. So it's a fine line, isn't it? I mean, there's a lot of unpicking I think we need to do in maternity care. I think we're moving there, don't you? I think
I think we are, and I think it's individualizing the discussion, right? And what I always say to my patients is, statistics are great when you're looking at a group, and when you're looking at the individual, you have to take into consideration, what is right for you.
Absolutely. From BMI to age to IVF, we don't have the data there.
No.
So we can't group them all in. And things like, when we're looking at birth for older women, And I don't know what your term in Canada is, but we still use geriatric mother.
Oh gosh, no, we don't use it at all.
Worse.
That?
No,
we say advanced maternal age, or I say mature mom.
Canadian and wonderful. Geriatric mother.
Oh no. I've heard the term, but I've never, in any of the centers I've trained or worked, we've never used it.
I'm sure it's getting less and less, but it is still.
That's horrible. Yeah.
Well, what we do when we take the information for older mums is that we aren't unpicking it to the individual.
Yeah.
We're throwing everyone in there. So you might be a marathon running, vegan, healthy, wonderful 42-year-old, but you're going to be put in the data pool with women who are not healthy and who may have problems. And we're going to umbrella that and say that's at an age. So you should not be walking around pregnant at 42 weeks. And it's difficult because then we're taking away rights and we're taking, the choice away. And we're putting guilt, I suppose, into it. The women are walking around going, what am I doing? I must be doing it all wrong. Yeah.
And then if there is a bad outcome, it lays on their shoulders, right?
Yeah. Which is mighty unfair, isn't it?
It is. So I think it all comes down to just, continuing to educate pregnant people and their partners, for them knowing, understanding how their bodies work, understanding, like you said, hypnobirthing. So I wish I had known more about it before I had my baby.
Oh, I wish I'd had it for my first. Right?
Yeah.
Seriously, going in armed with all that information and all the skills to remain calm and focused.
Yeah.
Oh, yeah. I wish I'd had it for my first.
I remember with my first, I pushed for 3 hours, which is a long time. But I had an epidural, and I have like the pelvis, the OP pelvis. So my second was actually OP. But and thinking I've run for longer than this. I've done like ultramarathons, so I could do this, right? And so I had some of that in my mind. And then with my second, he had a terrible heart rate, ended up being forceps, OP. And I just knew the statistics that like 99.99% of these babies are fine. So I wasn't anxious or worried. My husband was panicking a bit. And then afterwards, the obstetrician was like, that was kind of traumatic. And I was like, oh, not for me. Because I had the knowledge, that baby's going to be fine, right? Like, because they most often are.
You hear that time and again, don't you, with midwives who have given birth with a complication, and they're just like, no, I'll be fine. Totally. And then they talk to the midwife that helped with the birth afterwards, and that midwife's like,
and they're traumatized.
Yeah. But the midwife or OB was just like, chill.
Totally. And everyone's so terrified of forceps, right? Like, I feel like that's one of the things that most of my patients are like, I just don't want forceps. And I'm like, bring it on, get this baby out.
Yeah.
I always say, like, there's such an art to obstetrics and maternity care, right? It's science informed, but there's an art to it, right?
There's a person in front of you.
Yeah.
And it's meeting that person where they're at with the knowledge they have.
Exactly.
Hoping that they are fully prepared and knowledgeable moving forward.
Totally. That's great.
Because I imagine coming across you to give birth would be an absolute delight. But unfortunately, arriving at a very busy maternity ward in the middle of the night with very tired, stretched midwives, very different experience.
Totally. So if people are interested in learning more about your course, where can we send them?
Oh, to betterbirthstories.com. Come over. On the website, we've got everything. All about courses. We've got all manner of downloads. You get a free MP3, you get the birth planner, you've got the blog, which is generally on Instagram as well.
Okay.
And then just come to the birth room, come to the Hypnobirthing and Positive Birth group. Just join and let people in once a week, because there's quite a lot of people joining these days.
That's awesome. Yeah, I'll put the link
in there as much as I can, answering questions and just directing with evidence and information and reading. Just come in and join the conversation.
Okay, awesome. I will.
It's fascinating, and it is interesting, and it is life-changing, and
it's empowering.
It changes families. You get a good birth, positive birth experience. You get, irrespective of the type of birth, you get a hands-on family and birth partner. It's life-changing. It's that family's then going to move off in a direction which is positive and really going to inform those early years. It does make a big difference. And I think maybe we've just brushed it under the carpet and said it's not a big deal, you'll get over it. And that's not good enough, is it? Because it is life-changing.
It is. Yeah.
Best thing has ever happened. The 3 kids drive me mental.
Oh yeah. Right? Oh my gosh. As I hide in my closet from my youngest.
You're in your closet. I'm upstairs with the door shut.
Yeah. Oh my gosh. Well, we'll put all the links to everything in the show notes, so people will be able to access you. And just thank you so much for taking the time to chat with us.
Thank you. It's an absolute treat.
Total
treat. And I'll look forward to connecting on Instagram more.
Absolutely. Thanks, Melanie.
All right, take care.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.